Nursing is, at its foundation, about creating space for others. This is even more true for those that have little space of their own. Let me explain with the breath. Please, everyone, take a big inhale and exhale with me. Let's do that again. Inhale in and exhale out. On the inhale, the diaphragm contracts, straightening and putting pressure on the abdomen. The muscles in the torso lift and expand the chest by spraying the ribs outward. As the pressure inside the lungs changes, the air rushes to the space that was created. This air provides our body with oxygen in exchange for carbon dioxide and nurtures us. Inhale in, exhale out. The diaphragm relaxes, shrinking towards the center. The muscles in the chest begin to recoil from their stretched state as the pressure in the torso rises, pushing air out once again. The heart rate slows, decreasing the blood flow to the lungs as the pressure forces air out through the nostrils. This decreased heart rate, in sync with the breath, signals to the brain to slow regions responsible for flight or fright response and releases calming endorphins. The space that's created in the lung changes spaces in the brain. One last time, inhale and exhale. I felt the cold, wet gel hit my hands as I took an inhale in. Inhale in confidence, I said to myself. As I rubbed the sanitizer in circular motions around my hands, I breathed out. Exhale, kindness. This had become a sort of mantra of mine as I walked into a patient room, never knowing exactly what I would encounter on the other side of the door. As I heard a loud noise from down the hallway, I quickly pressed my palm into the wall dispenser once again, sensing I needed an extra dose of confidence for what I might find this time. I shuffled a few seconds behind the behavioral health techs, who were already attending to the child who was screaming outside of the day room. Before I could glance in their direction, I encountered a second child. He was small, the sort of small you wanted to pick up, throw over your shoulders, and watch as he delightfully giggled. In this moment, however, I was noticing how small he seemed in this hospital. Its white, sterile halls contrasted against his ebony skin. He had big brown eyes that burrowed inquisitively into whatever was around him, which, at this particular moment, happened to be me. Another loud noise echoed across those walls as the curiosity began to morph into fear and then distress. I had been floated to this unit, and I didn't know what might work for him as he was on the edge of sensory overload. The distress began to move from his eyes into his forehead as his eyebrows scrunched towards the center of his face. I took an inhale in and exhale out instinctively, and to my surprise, so did he. So I took another big breath in and out, and he imitated me that time too. We kept going, breath after breath. In the back of my head, I had already developed an escalation plan, his medications for agitation, reviewing therapeutic holds. But thankfully, the breath work was enough this time. His eyebrows returned to their normal position and the deep curiosity back to his eyes. On the next exhale, his hands pounced towards the sides of his face as he let out a small roar. He was, after all, not even 5 years old. "Who taught you this?" I asked. "Oh, the last time I was here," he said. "Breathing, kicking a ball, running back and forth. These are my coping strategies when I'm upset. But sometimes," he said with his eyes downcast, "they don't work for me if I'm at home and it's too loud. Sometimes there's just not enough space for me." That last part made me gasp a little bit. My 5-year-old patient had so articulately described a nursing diagnosis, a clinical intervention, and a barrier to implementing it. The wisdom coming out of his little body defied what I could have expected developmentally for a child his age. I later learned that this patient lived in a 1-bedroom apartment with a handful of other siblings, and he had been in the hospital for over a month, not able to return to his family. At this stage, it was unclear if it would be a safe discharge plan for him. The intergenerational trauma that he and his family had endured was profound. This child, like so many others that I helped treat in inpatient psychiatry, is breathing in systems and spaces that are actively designed against them. But while the world continues on its slow but persistent arc of justice, I'll never forget this child's insight, resilience, capacity for wonder, in spite of these obstacles. All he needed was a little bit of space, and he caught his breath in that moment. So I invite you to notice what's around you. And on this next inhale in and exhale out, take note of how much space you have. Nursing is about creating space for others, and we all have the opportunity to be in the same air as someone else, perhaps increasing their capacity for breath and space in their body and in the world. Thank you.